Thank you, Ciarán Corla. The question I have for the Minister is if he could detail the current capacity of our COVID-19 test, trace and isolate system, what number of contact tracers are presently in place, and if he could detail the matter. Thank you.
Thank you very much, Deputy, for the question. In line with the evolving public health advice, the HSE has put in place a very comprehensive, very reliable and very responsive testing and tracing operation. Testing and contact tracing continues to be a very important element of our response. Our current swabbing capacity is 175,000 tests per week. Demand for testing and tracing is high, as the Deputy will be aware, but walk-in test centres around but every test centre, I beg your pardon, around the country is currently accepting walk-ins, which I know has been received very well in local communities around the country. And alternatively, a test can be booked on the new online booking portal for any nearby test centre, so it's very, very accessible right now. Contact tracing centres are operating 12 hours a day, 7 days a week, and are fully rostered every day. The dedicated workforce, now totalling 930 contact tracers, has been really important to ensuring adequate capacity for contact tracing, up to 1,600 detected cases per day. This involves full data gathering and phone calls to all cases and their contacts. The service can now deploy digital mechanisms to significantly increase capacity and continue to contact trace through surge periods if the daily rate goes above that 1,600 cases per day. The testing and tracing programme undergoes continual evaluation and development in response to changing demands and evolving evidence. The HSE has been provided with resources to maintain a very robust testing and tracing system to meet this ongoing demand. It ensures that the potential to detect and mitigate the impact of the virus across our population is maximised.
Thank you, Minister Oireachtas.
Thank you, Ciarán Corla. Thank you, Minister. On the 8th of May 2020, I requested from Leo Varadkar a roadmap for testing and tracing. He was then the acting Taoiseach, and who said he would indeed ask the HSE to produce a roadmap. And on the 14th of May 2020, we saw that roadmap. He said, "Our mission," and I quote, "our mission is to get people back to work, get businesses opened again, and get the economy humming, so as that we have the resources we need to build a better society. We will maintain an intense focus on the virus and following 4 guiding principles: isolate, test, trace and treat, so we can quickly react if things go wrong and if we see an increase in cases. The crucial thing is to keep doing the right thing, stick to the strategy and maintain our focus." At that time, Minister, we had 234 contact tracers. I'm glad to hear that we now have 930, but I want to know, are they full-time, working continuously for the 12 hours, and what capacity of tracers, of people do they trace individually?
Thank you, Deputy. And Tara.
Thank you very much, Deputy. So we've got the 930 staff in place now. As to who's working exactly what hours, I don't know, but what I can confirm to you, I think the bit we're interested in is the contact tracing capacity operating to the full potential 12 hours a day, 7 days a week, and the answer is that it is. Now, we do quite in-depth contact tracing compared to a lot of other countries. So we do the contact tracing for the various protocols, full phone calls, follow up on their close contacts. It's a level that a lot of other countries don't do, but we have found it very, very useful in terms of identifying local outbreaks, and then the public health teams have gone in. So for example, not far from your own constituency in Dungarvan, you'll be aware there was a very serious outbreak recently. It was identified, contact tracing was done, and the public health teams were able to go in, engage with people, and thankfully in Ireland we have a fantastic response from the public, and they really do isolate themselves, protect everybody else, and as a result of that, outbreaks like that are being contained all the time.
Thank you, Minister. I think the issue here is that it's about the capacity when the numbers start to grow. And today we're at 600 on average, all for the last week. And at the time when we had 234 contact tracers, we were at 1,200 a day. So I appreciate that you were able to handle the situation in Dungarvan, the test, trace and isolate system. I'm asking for the future when we get above 1,200, because that's when it collapsed last year. So what is our capacity when we come under pressure. If we were to do the current tracing today, which if each person had 5 close contacts, which is a minimum, one would imagine this day and age, and where we are today, that would mean we'd need to contact 3,000 people on a daily basis currently. So that's why I'm interested. I want to know it's a robust system. I want to know it's not going to collapse and we're going to go back into lockdown because we haven't resourced our testing, tracing, isolating capability.
Thank you, Deputy. On Tara.
Thanks very much for that, Deputy. So where we're at is the daily capacity is now has been significantly increased. So it's 1,600 cases per day, so detected cases per day. However, you raise a very important question, which essentially is, well, what happens after that? What happens after 1,600 cases a day? And based on what we're seeing in Scotland, based on the modelling we have from Professor Nolan's team, we will very likely be looking at over 1,600 cases a day, right? So there's various protocols that get put in place around using electronic means, shortening the phone calls so that you can further increase capacity. But probably the most important part of the answer comes from the CMO, where he made the point last winter when it happened, and in the discussions we're having right now with the HSE about what exactly do we do when this level is reached. The point the CMO made was there comes a level of virus in the community after which actually contact tracing becomes far less relevant. Contact tracing is really, really important when you're dealing with isolated outbreaks. You can find people, protect people, isolate them. But as the CMO says, you get to a point where actually it's really not the focus, and the focus becomes more population-based tools.
Thank you very much, Minister.